we welcome you all to the second day morning inaugural session in first national conference on NCD in Bangladesh. I am Dr. Fariha Hassin, Associate Professor, Department of Public Health and Informatics, Bangabandhu Sheikh Mujib Medical University, is welcoming you all in second day morning inaugural session. We are very happy to announce that in this session, the chief guest will be Mr. Sheikh Fazli Nur Taposh, Honorable Mayor, Dhaka South City Corporation. Special guest will be Mr. Tanvir Shakil Joy, Honorable Member of Parliament, Sirazganj 1, Bangladesh National Parliament. The session will be chaired by Professor Dr. Ridwanur Rahman, Professor and Head of Research, Universal Medical Research Center. We will have with us special guest, Professor Shahla Khatun, National Professor, Professor ABM Abdullah, Professor University Grants Commission, guest of honor, Mr. Muhammad Abul Kalam Azad, ex-Principal Secretary and Special Envoy, Government of Bangladesh, guest of honor, Dr. Muhammad Shahadat Hossain Mahmood, Director General, Health Economics Unit, Ministry of Health and Family Welfare, guest of honor, Ms. Sahan Ara Banu, NDC, Director General of Family Planning, Ministry of Health and Family Welfare, guest of honor, Shadhana Bhagwat, Team Leader, NCD, World Health Organization, Bangladesh, guest of honor, Professor Joe Ivy Buffold, President, International Society for Urban Health, guest of honor, Professor John Wilding, President, World Obesity Federation, and we will have with us Dr. Monir Ahmed, Country Director, Orbis International. Now, may I request the session chair, Professor Dr. Ridwanur Rahman, to take the seat in the podium with the guests. May I welcome sir to come on the stage and to take seat. We passed a very fruitful and exciting yesterday. We have seen a very interesting research findings yesterday. Today, we will also have a very fruitful discussion on NCDs, and we will have several scientific sessions in the second day. So let's start the session with the permission of the chair. Sir, may I start the session, please? Okay, thank you, sir. Now, I would like to request Dr.
Recording in progress.
Thank you. Now, I would like to request Dr. Monir Ahmed, Country Director, Orbis International, to give his welcome speech. Sir.
Hello, everyone. A very good morning to you all. Honorable Chief Guest of the ceremony, Mr. Sheikh Fazli Nur Taposh, Honorable Mayor, Dhaka South City Corporation, Government of the People's Republic of Bangladesh, respected Chair of the ceremony, Professor Dr. Ridwanur Rahman, Professor Head of Research, Universal Medical Research Center, distinguished guests of honor of the ceremony, Professor John Wilding, Professor Joe Ivy Beaufort, Professor Anil Duke Cruz, Ms. Sadhana Bhagwat, Ms. Shahanara Banu, NDC, Dr. MD Shahadat Hossain Mahmood, Mr. MD Abul Kalam Azad, ex-Principal Secretary and Special Envoy to the Government of Bangladesh, and respected special guest of the event, Professor ABM Abdullah, University Grants Commission, Bangladesh, and Shahla Khatun, National Professor, Mr. Tanvir Shakil Joy, Member of the Parliament, Sirazganj 1. Learned attendees, ladies and gentlemen, on behalf of the organizing committee of the first National NCD Conference in Bangladesh, I am privileged to welcome you all in the inaugural ceremony of our first NCDs conference in Bangladesh. The conference is organized by the NCDC, Ministry of Health and Family Welfare, Bangladesh Non-Communicable Disease Forum, Clinical Research Platform, Bangladesh Health Reporters Forum, and over 30 partner organizations. This is being held by adopting the hybrid type of session, virtual as well as in person. I am delighted to share you that your presence in person and through virtual platform shows immense response and commitment to thrive for making a difference and bring positive changes and lasting impact through our future work of NCDs, building on what we have already done. Ladies and gentlemen, indeed, Your presence and support is a demonstration of our partnership and collaborative efforts to address not only the immediate challenges of NCDs that we are currently burdened with, but also facing all the realities of the emerging impact of NCDs in our health, future generation, and our economy. This will indeed more engagement in research, awareness, program designing, evidence-based advocacy, and our readiness for the multi-sectoral coordinated action with sufficient monitoring in the coming days. We express our sincere appreciation again to Mr. Sheikh Fazlinur Taposh, Honorable Mayor, Dhaka South City Corporation, for his gracious consent in this ceremony. And we are grateful to Professor Dr. Ridwanur Rahman for chairing this session, and our distinguished guests and guests of honors and special guests who are attending virtually or in person. Finally, I take this opportunity to thank you all for joining us to moving the agenda forward and encouraging our organizers of the first NCD conference in Bangladesh. My special thanks to the moderator of this session, Dr. Faria Hassin, Associate Professor, Department of Public Health and Informatics, Bangabandhu Sheikh Mujib Medical University. And I also appreciate the organizing committee members, especially the Secretariat of BNCDF, led by the eminence, for taking the safety measures against increasing COVID-19 transmissions. With all your support, let us hope for a safe and successful conference of its first of its kind, which all move the agenda of NCDs in Bangladesh. Thank you all.
Thank you, sir, Dr. Monir Ahmed, for your informative welcome speech. Now, we would like to hear from Professor John Wilding, World Obesity Federation. So can we hear from Professor John Wilding, please? He has sent us the recorded message.
Dear colleagues and honoured guests, it's a great pleasure to be invited to close this important meeting on non-communicable diseases. I'd like to offer a warm greeting from Liverpool in the United Kingdom and in my role as President of the World Obesity Federation. As I am sure you all recognise, obesity is an increasingly important topic, not only in the part of the world where I live, where it is very prevalent, but also as it is emerging in developing nations. We also have to recognise that obesity is not only a disease in its own right, but also that it is a risk factor for many other chronic non-communicable diseases, including cancer, heart disease, and diabetes, that I know you have discussed in detail at this meeting. The importance of obesity as a disease has been brought into sharp relief during the COVID-19 pandemic, as it soon became clear that people living with obesity were at greater risk not only of catching COVID-19, but also of becoming hospitalized with the disease and having a higher rate of mortality. Hence, tackling obesity, along with other forms of malnutrition, will be important to build resilience as we recover from the COVID-19 pandemic and prepare, hopefully, to be in a better place for future pandemics of communicable diseases. As the World Obesity Federation, we recognise that the roots of non-communicable diseases, including obesity, are complex, and therefore solutions will require cooperation across different organisations within countries and across countries. This will, in many cases, align with other important priorities around health and nutrition, including ensuring adequate and healthful nutrition for all, but also with other priorities that are facing the world today, including climate change, where we know that if we align policies on healthful nutrition and climate change, we will be all living in a better world. World Obesity is working with organizations such as UNICEF and WHO to create new policies to help tackle obesity across the world. And I very much hope that yourselves and the rest of the medical and scientific community in Bangladesh will make an important contribution to those efforts. Thank you very much for listening, and best wishes for the rest of 2022.
Thank you, Professor John Wilding, with your very much encouraging message. Now I would like to request Ms. Shadna Bhagwat, Team Leader, Non-Communicable Disease, World Health Organization, Bangladesh, to deliver her speech. She is being connected with us on Zoom. May I request you, ma'am?
Good morning, and extremely sorry that I'm not there in person. It was just that I was in the field the last week, so I didn't want to put everyone at risk, supposing I have contracted the virus somewhere, so I'm addressing virtually. First of all, distinguished guests and dignitaries in the venue and those who have joined online, a very good morning, and thank you very much to the organizers for inviting me to this very important session. I was fascinated by the topic. It says NCDs, everybody's business. And I think it is very pertinent because we often either blame the patient who's got the NCDs or the doctor who's treating, while doesn't stop with the patient or the doctor. It is actually everybody's business. So I was just thinking about all the stakeholders who are important when it comes to non-communicable diseases. If we look at it right from the patient, he or her, and they're affected, it's not just something that the patient had done that made him get that or her that illness. The family and the caregivers are also affected. The community has a role. The society in which they live has a role. And of course, the health sector has a role. The policymakers, the private sector, the civil society organization, the academia, everyone has a role. And this is how the thinking around whole of government, whole of society approach evolved. NCDs, we all know that cannot be tackled by the health sector alone. In fact, health sector is largely very often the last stop where the patient has developed an illness or a condition and has approached the health sector because the NCD had not been prevented due to actions of many other stakeholders who are responsible for many actions that they have to take. If we look at, my professor used to always say, you can't keep on cleaning the floor if you don't close the leaking tap. Similarly, if we don't address the non-communicable disease risk factors, it is not possible to just go on treating the illness. It will be a never-ending story. So we have to take care of the risk factors, and we are all aware of the risk factors. We have the behavioral risk factors, the metabolic risk factors, and if we want to address these risk factors, it is not possible by the health sector alone. Many sectors have to come together, and WHO has come up with the best buys and other cost-effective interventions. These were, all of us are familiar with the Global Action Plan for Prevention and Control of NCD, and this was the Appendix 3 of it, which was updated again in 2017-18. In this, we have a menu of policy options that we can adopt. There are 16 very cost-effective, that's what we call the best buys. 16 interventions are given, which all cost less than $100 per DALY to be awarded. Then we also have other interventions. A total of 88 interventions are there in this best buys and other cost-effective interventions. And 88 interventions, some of them are best buys, some of them they cost a little more than $100 per DALY averted. But this is not to say these are not good. And similarly, there are some other interventions which at this point of time may not have a very good cost analysis, but at the same time, all these policy options are to be adopted by the country depending on the country context. If we take for example, salt reduction, which is a very important component of unhealthy diet. We have to raise awareness. We have to change the labeling so that the front of pack labeling can be adopted. We should talk to the manufacturers to reduce the content in the salt, the content of salt in the food. So if we look at it, all these fall outside the purview of the health sector. So we have the multi-sectoral action plan for prevention
Thank you.
and control of
And
NCDs.
let me thank the sponsors of this.
So, I
Dear
will stop
colleagues and
here.
honoured guests, it's a great pleasure to be.
I think there's some disturbance. Anyway, I've come to the end of my speech. So we have to join hands to tackle these risk factors and the disease. And I hope the first conference that has been organized here in Bangladesh is going to give a very big push to the NCD agenda in Bangladesh. And we hope that we will see more and more action and traction to address NCDs in Bangladesh. I wish the organizers and the conference all success. Thank you for inviting me.
Thank you so much, Madam Sadhana Bhawat, Team Leader, Non-Communicable Disease, WHO Bangladesh. You always play a very important and prominent role for controlling the NCD nationally and globally. Thank you once again. We are going to listen from Professor Dr. Joe Ivy Buford.
Of the Health Service of the Ministry of Health and Welfare, the Bangladesh Non-Communicable Disease Forum, Bangladesh Health Forum, Health Reporters Forum, and the Clinical Research Platform. I especially want to thank my colleague and friend, Shamim Talukdar, who's the Chief Executive Officer of Eminence Associates for Social Development, serving as the Secretariat for this important meeting. I'd like to share my screen with you. I'm speaking to you as chair of the board of the International Society for Urban Health. And we are very excited about and committed to the important engagement of community-based organizations and partnerships in cities. ISUH is the only global non-governmental organization focused solely on advancing urban health and health equity by addressing the broad determinants of health. We were pleased to have our global conference in Dhaka in 2015, hosted by Eminence. And we've also worked with Eminence and partners in a series of webinars on the COVID epidemic last spring, culminating in a meeting as part of our international conference held virtually in July on the role of community-based organizations, especially linking in partnership with primary care and government officials in addressing COVID, but also the broader determinants of health. This is a familiar diagram for most of you. It really shows that in this period of COVID, it's critical to remember the long-term threats of non-communicable diseases, especially cardiovascular disease, cancers, chronic pulmonary disease, and diabetes, which continue to be the major causes and sadly the growing causes of death and disability worldwide. We also saw front and center how they put individuals at greater risk for COVID and also at greater risk for the inevitable future infectious diseases that we will have to contend with. It's crucial that we continue our focus on prevention, especially at the community level. Here at ISUH, we use this broad definition of health, of the factors that influence health, beginning in the inner circle with those traits to which individuals are born and the individual lifestyle factors that they have as individuals, but also shaped by the communities, the family patterns and communities in which they live. And the conditions in these communities are very much determined by policies of government in areas like work, unemployment, water and sanitation, housing, and agriculture, in terms of the variables that have to come together to have people live in healthy communities. This is a diagram that really represents, we use it for cities, that can also be used for higher levels of government and nations, but it really shows us how the health influences that come from multiple sectors outside the health sector. And every day decisions are being made by city leaders, by national leaders in these areas that influence health. So while we have the important health sector represented here, especially the importance of primary care practices, we also highlight the importance of community engagement in decision-making, community cohesion, and the crucial importance of governance, government being the government areas, but also connected to community-based organizations, the private sector, and academia and media, as I know, are well represented at this meeting and crucial to communication. If we look around this circle, we can see how decisions made in the transportation sector for cars versus mass transit versus active exercise, such as bicycles and electric vehicles, can change dramatically the health conditions in cities with air pollution, road traffic accidents, reductions in exercise that can lead to obesity. Decisions made in urban planning to maximize green space in parks and areas of recreation also have a huge impact, not only on mental health and physical health, but as well on the quality of air and water. Built environment, the quality of housing, the quality of our buildings and building materials can address huge savings in energy. So all of these areas become really important, and they need to be pulled together with government leadership, but in crucial partnerships with across government in different government agencies, but also with community-based organizations, the private sector, academia, and the media, to be sure that interventions are the most effective. Business has been a very important partner in efforts to combat chronic diseases, and organizations like the Novo Nordisk, businesses like Novo Nordisk, with Cities Changing Diabetes, and Novartis with its Better Hearts program, have developed nationwide networks of cities in which they work with government officials and stakeholders to create conditions for prevention, treatment, and rehabilitation of chronic diseases. This is our traditional model, and it's very important to strengthen all of those activities on the left in what has been a focus of the World Health Organization and many of us involved in healthcare and healthcare systems for some years. How do we strengthen the comprehensiveness of health systems, assure an adequate and safe workforce, be sure essential medicines are available, and most recently with major efforts to provide universal financial coverage and access to healthcare. We need to strengthen that line of activity, but also to connect it with efforts in other sectors, such as across the agencies and partners in the previous diagram, looking at health in all policies. How do we make healthful decisions in areas like urban planning, transportation, housing, economic development? There are clearly decisions that can be made that improve health and decisions that make it more difficult to have healthy communities for individuals to be healthy. So let me stop there and again, congratulate all of you on an excellent conference over the past few days. We look forward to seeing the results, both for national leadership on the issue of non-communicable diseases in Bangladesh, but also to the degree that Bangladesh has often been a health leader in its region, for regional leadership as well. And we thank you for bringing back the world's attention to non-communicable diseases and the importance of sustaining our efforts there to keep our patients and our communities healthy. So again, thank you. And let me end by inviting you to our next International Conference on Urban Health to be held in October in Valencia, Spain. And we hope all of you will join us from all disciplines, sectors, and agencies to improve the health of our urban communities. Thank you very much.
We are very much delighted to welcome the chief guest of this program, Mr. Sheikh Fazli Noor Taposh, Honorable Mayor, Dhaka South City Corporation. We are welcome you, sir. Now we would like to request to deliver the speech Mr. Muhammad Abul Kalam Azad, ex-Principal Secretary and Special Envoy, Government of Bangladesh.
Honorable Chair, Honorable Chief Guest, special guests, guest of honors, and dear participants, good morning to you all. I'm very delighted to be here to join this NCD conference. If we look into the statistics, till today, about 5.6 million people died in last 2 years out of COVID. But if you take the figure of non-communicable disease, this is yearly 41 million. So this is 14 times devastating than that of the COVID. The whole globe is very cautious, anxious, addressing this COVID. Yes, COVID could be much more devastating. But the figure is with us, 41 million per year. So what are we doing for that? And we know the 4 major causes, that is the heart, cancer, lung, respiratory, and diabetic. These 4 are the major killers in NCD. Are these being addressed? How? In Bangladesh? Yes. If you see in our country, infrastructure of health, community clinics started with 6,000 people in the rural area. And gradually in the union level, Upazila, district, and the specialized hospitals. In last decade, a huge number of medical college, medical hospitals, and specialized hospitals and institutions were established, taking care from eye, kidney, mental, anything and everything. But we need to go a long way. Where we are lagging in primary health care, universal health coverage, Bangladesh still is lagging behind. If we see our economic progress, in last 12 years, it is quadruple, from $6,050 per year to now more than 2,500. And we will not stop here. In next decade, we will be, not next decade, by 2041, we will be a developed country, and that time our per capita income will be 12,500. Considering this, we need to look into our health issues also. We know our life expectancy is more than 72. For the women, this is 73. And we understand that in our lifetime, we saw that the life expectancy was only 45 when I was a child. So maybe we will see the life expectancy will be much more than 80. Out-of-pocket expenditure in Bangladesh. This was supposed to be going down gradually, but unfortunately, it is going up. We need to address this issue, that how best we can reduce the out-of-pocket expenditure. We are very good in rural health coverage by putting the community clinic. What's about the urban? Any patient with any disease, he shoots to the Dhaka Medical College or Bangabandhu. But there are some other hospital. We need to establish some other small clinics where these patients can be treated and the burden of Dhaka Medical College or the specialized hospitals reduces. In turn, they can give better services to the patients. The main cause of non-communicable diseases, basically climate change and the food habit. You all know Honorable Prime Minister at present is the chair of the Climate Vulnerable Forum, which is a forum of 55 countries. Amongst other, health is one of the important issues to address in these 55 countries. Honorable Prime Minister is leading these 55 countries in terms of climate change, in terms of vulnerability of women. We understand that this issue of non-communicable disease with the Climate Vulnerable Forum will be addressed best. What we need to do, especially my idea will be in 3 areas. We need to have the proper manpower. In last 10 years, huge number of health officials has been recruited. We need to place them properly, train them properly. And in terms of infrastructure, we have gone a long way, but we need to go further. I understand the initiative which has been taken by this organization, where we are having this conference of non-communicable disease, making more important issue for the whole nation. We understand that this conference will take the message to the common people how best the disease can be prevented. We all know prevention is better than cure. Thank you very much.
Thank you, sir, for your very nice directional speech. Now I would like to request the chief guest of this session, Mr. Sheikh Fazli Nur Taposh, Honorable Mayor, Dhaka South City Corporation, to deliver his speech. Sir.
Thank all the concerned for inviting me as chief guest of this first national conference of non-communicable diseases in Bangladesh. It's a privilege for me. I thank all concerned. I would like to say a few things. I've been given a written speech, so I will go by the written speech first, and then I will add a few concerns or aspects with regard to urban health as being the mayor of Dhaka South City Corporation. No doubt we are all aware that non-communicable diseases are the leading causes of death in Bangladesh. It contributes about 60%, 67% of all deaths, and the human toll of NCDs is completely unacceptable. They carry a huge cost that extends beyond health to trap people in poverty, especially, while depriving people living a life of dignity, weakening the workforce productivity, and threatening, of course, economic prosperity. A recent study on Ncd Risk Factors in Bangladesh figured that 97% of the population belonging from range 18 to 69 years old has at least one risk factor. That is very alarming. For instance, high blood pressure, high body mass index, tobacco use, salt and trans fat consumption, low intake of fruits and vegetables, and physical inactivity. Both in urban and rural areas in Bangladesh, we are witnessing the high prevalence rate of diabetes, weighing the rate from 4.5 to 35%. More than 8.4 million people are estimated to be living with diabetics, and a similar number are at the risk of developing type 2 diabetics. And the prevalence will be 13% by 2030. When we say 2030, we feel that it's very far away, but it's not. It's only 7 years from now. We are at 2022. So after 7 years, we're getting 2030. In 2020, Cancer Country Profile mentioned of around 150,781 new cancer cases in Bangladesh. I doubt this data because, as we see, we hear a lot. I mean, almost every family there is one cancer patient. So I think this figure would be much more than what has been reported. Among them, 83,715 are male and 67,066 are female. As I mentioned, I doubt this data because as a representative of the people, I get along with so many families, so many people, and I hear their outcry and their agony when I come to notice that almost every family has a patient of cancer. So this is very, very alarming for us. Female patients are mostly becoming the victim of breast cancer, and near 13,000 cases of breast cancer accounts for the 8.5% of all cancer patients. And 6,844 of them die of the disease. However, the overwhelming expenses, scarcity of professionals, and unavailability of equipment have made cancer treatment inaccessible to hundreds of victims or sufferers in Bangladesh. Moreover, cardiovascular disease, with an increasing number of patients suffering from it, topping the list in NCDs in Bangladesh, which is very obvious. Research suggests CVD to be the top cause of mortality, morbidity, and hospital admission in the country. One good thing in this aspect is that Bangladesh has now become more or less self-sufficient in the resources, in the capacity of the professionals of our country who can take care of patients of heart diseases. That's the one good aspect that has grown in the last 1 or 2 decades. Government has taken lots of initiatives under the leadership of our Honorable Prime Minister, Sheikh Hasina. However, to meet this NCD's challenge, the government of Bangladesh has identified NCD as a new and continuing burden for healthcare system, which is very rightly done so, and has taken steps to prioritize expansion of services related to NCD control activities. The current sector-wide program, the 4th Health, Population and Nutrition Sector Program, HPNSP, 2017 to 2022, concluding this year, includes a component focusing on prevention, control, and management of NCDs in Bangladesh. Prevention, of course, is of highest priority. Honorable Prime Minister Sheikh Hasina has taken an initiative to set up specialized cancer hospitals in 8 divisional cities of the country. I thank Honorable Prime Minister Sheikh Hasina for this far-sighted initiative she has taken. At this moment, many may argue that the prudence or pragmatism of this policy, but I personally feel that this is very essential, and this will create the resources, the capacity building, and of the whole health system of our country. Besides, the government started a curative initiative for people living with diabetes and blood pressure. I must add that huge amount of people suffer from high blood pressure, and it causes huge amount of death. I have not been given the statistics on this issue, but I feel that I hear a lot, many who die because of this cause of high blood pressure. It's a hidden killer. It's a hidden killer. The government is also committed to tobacco-free Bangladesh by 2040. In 2012, the government initiated a new initiative under which NCD corners at Upazila sub-district health complexes. UHCs, which were established by addressing NCDs. The government provides 5 types of medicine free of cost through the NCD corners at the Upazila level. This may sound very meager, but it is very essential. The National NCDs Conference indeed is a great initiative taken during this challenging hour of COVID-19. And I again congratulate all concerned for holding this conference, the first national conference for NCDs, which is very, very significant and important. I believe it will bring the burning issues related to NCDs under spotlight to reflect and act on the management, treatment, and prevention of NCDs. Most importantly, the Nation NCDs Conference, Bangladesh Declaration, will be endorsed by the government and will help us as a guiding light for the initiative to be taken both by the government and private sectors. We know that incredible works are going on across the country on NCDs, and still lots of action have to be taken to release our country from this burden for which our initiatives must be guided by the input of all concerned here. I assure my support and coordination to help meet these growing challenges so we can better create a ground for people living with NCDs and for the sector to build a resilient and firm workforce. In this aspect, I would like to add what the city corporation needs to do, but we do have some weaknesses. The city corporations are responsible for the, as we say, urban health, to reduce the risk of non-communicable diseases of our city dwellers, urban dwellers. Dhaka South City Corporation has already taken initiatives to establish more parks, walking facilities, wide footpaths. We want to create a pedestrian-friendly environment in the city. As you may also know, that are still about 40% of the people of the city dwellers commute through walking. We have taken initiatives and we are going for a master plan to enhance the standard of living of our city dwellers. You are, of course, aware that air pollution is a significant cause for respiratory diseases in our country. We are looking into that. Unfortunately, Dhaka has been termed as the highest air polluted city in the whole world. I do doubt that, but we have to accept that. So accepting that as a challenge, we have started working on it. Dhaka South City Corporation has 2 hospitals. The whole infrastructure establishment, this is of course ours. We used to lack some capacity issues, but now we are enhancing the capacity and services and the standard of services on our own. But there is a dilemma with the government in this aspect because the manpower, the resources, the professionals, the medical consultants, they are being recruited and provided by the government. And unfortunately, we do not get enough resources, manpower, professionals for our hospitals. You may have seen recently as well, it has been reported that in our one general hospital, we have a surgery section and a medicine section. Unfortunately, for the last 25 years, our surgical section has not been functional because the government has not provided us the professionals and the consultants for the surgery section to be functional. We have been having conversation and debate or demands and arguments with the government, but still we have not get gotten any professionals and consultants with regard to that. So these issues are there, but we are working hard on that, and on our part, we are trying our best to enhance the capacity and services as much as we can within our limits. But more need to be done with regard to that. I really hope that jointly with the government concerns and the private sectors and the professionals, we can overcome all these challenges on our part. Finally, I extend my heartfelt gratitude to the NCDs, DGHS for their wise leadership, and Bangladesh Non-Communicable Diseases Forum, Clinical Research Platform Bangladesh, and Bangladesh Health Reporters Forum for their tremendous effort in organizing this first national NCDs conference in Bangladesh. I also express my thankfulness to every partner and sponsor organization for playing the expected role for our country, and of course all the stakeholders and participating institutions and individuals for this taking this effort and coming and joining this conference. I thank all concerned again. Joy Bangla, Joy Bangabandhu.
Thank you so much, sir, for your very insightful and directional speech. With the permission of the chair, now I would like to request Dr. Mohammad Shahadat Hossain Mahmood, Director General Health Economics Unit, Minister of Health and Family Welfare, to deliver his speech. He had an family issue, urgent issue today, so he was a little bit late. Still, sir is with us, so we are requesting him.
Respected Chair, respected Chief Guest, special guest and guest of honor, and prudent participants. Assalamu alaikum and good morning. It's my pleasure to be here to share some of the views of mine regarding the issues of today's conference, that is National NCDs Conference 2022. To my understanding, the realization most of you are Bengali speaking, so I will deliver my speech in Bengali, but the key points I will also discuss in English, so that others who are actually linked with Zoom can understand it clearly. আমি পার্সোনালি বাংলাদেশকে অত্যন্ত ভাগ্যবান মনে করি একটি কারণে। আমাদের জাতির জনক হাজার বছর শ্রেষ্ঠ বাঙালি বঙ্গবন্ধুর নেতৃত্বে আমরা 1972 সনে যে সংবিধানটা পেয়েছিলাম, সেখানে এমন কিছু বিষয় সন্নিবেশিত হয়েছে যেগুলো সত্যিকার অর্থে আমাদের স্বাস্থ্য খাতের বর্তমান সময়ে যে সমস্ত পদক্ষেপ গৃহীত হচ্ছে গ্লোবালি সেটাকে সমর্থন করে। খাদ্য, বস্ত্র, আশ্রয়, শিক্ষা এবং চিকিৎসা 5টি বিষয়কে মৌলিক চাহিদা হিসেবে আমাদের সংবিধান স্বীকৃতি দেওয়া হয়েছে এবং সেগুলোকে পূরণ করবার জন্য রাষ্ট্রের উপর দায়িত্ব অর্পিত হয়েছে। Actually, food, clothing, shelter, education and healthcare are declared as basic human needs, and state has given the responsibility to ensure it for the entire population. আমরা আজকে যে সর্বজনীন স্বাস্থ্য সেবার কথা বলছি, সেখানে আমরা বলি 3টি ডাইমেনশন। আপামর জনসাধারণকে স্বাস্থ্যসেবার আওতায় আনতে হবে, তাদেরকে পর্যাপ্ত মানসম্মত স্বাস্থ্যসেবা দিতে হবে এবং এই সেবা পেতে গিয়ে তারা যাতে আর্থিক বিপর্যয়ের মুখে না পড়ে সেটি নিশ্চিত করতে হবে। 3 dimensions of universal health coverage, that is access of the entire population in the healthcare, to provide them adequate quality healthcare and to give them financial risk protection, is also very much in the constitution of our country. That is very much linked with the universal coverage. So we are very much, I think, fortunate, but the fact is that due to various reasons, we could not achieve the targeted goal in the health sector. এত চমৎকার একটি সংবিধান থাকা সত্ত্বেও আমরা স্বাস্থ্য খাতে প্রত্যাশিত অর্জনটা করতে পারিনি। অনেক কারণ আছে, সে কারণে আজকে কথা বলবো না। তবে আমি আপনাদেরকে আনন্দের সাথে বিনয়ের সাথে যে তথ্যটা জানাতে চাই সেটি হলো বর্তমান সরকারের সময়োপযোগী এবং গতিশীল নেতৃত্বে সারা বাংলাদেশ যখন উন্নয়নের মিছিলে এগোচ্ছে, আমরা বলি যে উন্নয়নের মহাসড়কে অবস্থান করছি, স্বাস্থ্য খাত তার থেকে ব্যতিক্রম নয়। স্বাস্থ্য খাতে আমরা অভূতপূর্ণ উন্নতি অর্জন করতে সক্ষম হয়েছি। আপনারা জানেন যে ল্যান্ডসেটের একটি রিপোর্টে যুক্তরাজ্য ভিত্তিক গবেষণা প্রতিষ্ঠান স্বাস্থ্য খাতের যে রিপোর্ট করেছে, সেখানে বাংলাদেশের অবস্থান থেকে আমাদের পার্শ্ববর্তী দেশসমূহ থেকে অনেক উপরে তুলে ধরা হয়েছে, এমনকি ভারতের থেকেও। আপনারা দেখেছেন সম্প্রতি করোনার নিয়ন্ত্রণে এবং ব্যবস্থাপনায় বাংলাদেশ অভূতপূর্ণ সফলতার পরিচয় দিয়েছে। সারা বিশ্বে বাংলাদেশের অবস্থানটা 28তম। হয়তোবা পরবর্তী রিপোর্টে এটা আরও কয়েক ধাপ উন্নত হবে বলে আমরা বিশ্বাস করি। সব কিছু সম্ভব হয়েছে সরকারের সময়োপযোগী পদক্ষেপ গ্রহণ করার কারণে। আপনারা জানেন যে স্বাস্থ্য খাতে আমাদের জনবলের যে সমস্যা ছিল তার অনেকটাই পূরণ করা হয়েছে। অনেক মেডিকেল কলেজ, নার্সিং ইনস্টিটিউট প্রতিষ্ঠা করা হয়েছে এবং বরাদ্দটা আগের থেকে অনেক বাড়ানো হয়েছে। হর হামেশাই একটি অভিযোগ ওঠে, সেটি হলো স্বাস্থ্য খাতে আন্তর্জাতিকভাবে যেখানে স্বীকৃত কমপক্ষে 15% বাজেটের অর্থ বরাদ্দ দেওয়া উচিত, বাংলাদেশে সেটি মাত্র 5%। আমি বিনয়ের সাথে এই তথ্যের সাথে আরও কিছু বিষয় যুক্ত করতে চাই। আমরা 5% দেওয়া হচ্ছে স্বাস্থ্য খাতের স্বাস্থ্য বাজেটে, বাট এর বাইরেও স্বাস্থ্য খাতে আরও কিছু বরাদ্দ আছে, কারণ স্বাস্থ্যের বরাদ্দ স্বাস্থ্য মন্ত্রণালয়ের বাইরেও আরও 15টি মন্ত্রণালয় এবং বিভাগকে দেওয়া হয়ে থাকে। সেগুলো যোগ করলে এই বরাদ্দটা হয়ে যায় প্রায় 7.5%। এর বাইরেও থোক বরাদ্দ আছে। আপনারা দেখেছেন এইবার কোভিডের কারণে শুধুমাত্র টিকার জন্যই প্রায় 20,000 কোটি টাকা খরচ করা হয়েছে। মাননীয় প্রধানমন্ত্রীর একটি তহবিল আছে, সেখান থেকেও স্বাস্থ্য খাতে বিভিন্ন সহযোগিতা দেওয়া হয়ে থাকে। সব মিলে যদি আমরা এই টাকাটা খরচ করি, হিসাব করি, তাহলে 10% কাছাকাছি হবে। কিন্তু আমরা সেটা হিসাব আনি না, হিসাবটা করতে হয় একটি আন্তর্জাতিক নিয়ম অনুযায়ী, সেই নিয়মে সেই টাকাটা হিসেবে আসে না। দ্বিতীয়ত আমাদের আরেকটি অভিযোগ থাকে, সেটি হলো আমাদের আউট অফ পকেট এক্সপেন্ডিচার অনেক বেশি। এই কাজটি আমি স্বাস্থ্য অর্থনীতি ইউনিটের মহাপরিচালক, আমার এখান থেকে রিসার্চটি করা হয়ে থাকে, বাংলাদেশ ন্যাশনাল হেলথ অ্যাকাউন্টস, সেখান থেকে উঠে আসে আমাদের 67.5% অর্থ জনগণ পকেট থেকে ব্যয় করে। এটি নিঃসন্দেহে অনেক বেশি, কিন্তু এখানেও বোধ হয় আন্তর্জাতিক নিয়ম মানতে গিয়ে আমরা একটি হিসাব বারবার বাদ করে যাই। সেটি হলো আমরা যারা সরকারি কর্মচারী, যারা দায়িত্বরত রয়েছে এবং যারা রিটায়ারমেন্টে রয়েছেন, তাদের জন্য সরকার প্রতি মাসে হেলথ অ্যালাউন্স দিয়ে থাকে 1,500 থেকে 2,500 টাকা পর্যন্ত। এটির পরিমাণও প্রায় 6,000 কোটি টাকা। এটিকে কিন্তু কাউন্ট আনা হয় না। সব কিছু কাউন্ট আনলে হয়তো বা সরকারের অংশটা এখানে অনেক বেশি হতো। আর থোক বরাদ্দের কথা বললাম, চলমান অর্থ বছরে কোভিডের কারণে যে খরচটা করেছে সেটা কাউন্ট করলে সরকারের অংশটা বোধহয় অনেক বেশি হবে। আমি এই কথা বলার একটি উদ্দেশ্য, অর্থাৎ সরকারের পক্ষ থেকে স্বাস্থ্য খাতে বরাদ্দ দেওয়ার ক্ষেত্রে কোনো কার্পণ্য নাই, কিন্তু যে টাকাটা বরাদ্দ দেওয়া হয়ে থাকে আমরা সেটি সবসময় সঠিকভাবে ব্যবহার করতে পারি না। উই হ্যাভ ল্যাক অফ capacity to use the allocated money in health sector. So the allocation is not important, but how much we can use the money, that is more important. At present, the government has given emphasis for the develop the quality, develop the competence of the health managers so that they can use the money properly. Government arranges a lot of training programs for the health managers, financial issues, administrative issues, management issues, clinical issues, all these issues are included in the training programs. So we do hope that in future the health managers will be able to use the money properly and lot of health issues will be addressed properly. আমি যে কথাটা মুদ্রা কথা বলতে চাচ্ছি, আমাদের সরকারের সদিচ্ছার ঘাটতি তো নেই, বরং আমি বলতে চাচ্ছি আমরা অনেক বিষয়েই অনেক অগ্রগামী চিন্তা করছি, কিন্তু সেই চিন্তাগুলোকে সমন্বিতভাবে প্রয়োগ করতে পারলে আজকের যে প্রতিপাদ্য বিষয় নন কমিউনিকেবল ডিজিজ, সেটির হাত থেকে আমরা অনেকাংশে রক্ষা পেতে পারি। সরকার প্রিভেন্টিভ মেজার্সের জন্য অনেক উদ্যোগ গ্রহণ করেছে, অ্যাওয়ারনেস রেজিংয়ের জন্য, শিক্ষা বিস্তারের জন্য। শুধুমাত্র কমিউনিকেবল ডিজিজকে গুরুত্ব দেওয়া হয়নি, কারণ আমাদের রিসার্চে উঠে এসছে বাংলাদেশে এই মুহূর্তে যত মৃত্যু হয় তার প্রায় 70% মৃত্যু হয়ে থাকে নন কমিউনিকেবল ডিজিজের কারণে। গ্লোবালি ইটস এ প্রবলেম, অ্যান্ড ইট ইজ অ্যাজিউম দ্যাট in the year 2040, the total deaths for the NCDs may be 80% or more. So it is high time for us to think the issues, how we can protect the risk of NCD. আমি একটি কথা বরাবরই বলি, আজকে বলবো, কোভিড নিয়ে সারা বিশ্ব এই মুহূর্তে একটি ক্রান্তিকাল অতিক্রম করছে। আমরা বাংলাদেশে ইতিপূর্বে আমাদের লকডাউন ছিল, এখন লকডাউন যদিও নাই, তবে আমাদের অনেক কিছু সীমিত হয়েছে। কিন্তু কোভিডের যে মৃত্যু, তার থেকে আমাদের এনসিডির অনেকগুলো ঘটনায় মৃত্যুর সংখ্যা 10 গুণ 20 গুণ এমনকি তার থেকে বেশি। শুধুমাত্র ধূমপানজনিত কারণেই বাংলাদেশে প্রতিদিন গড়ে মৃত্যু হচ্ছে 350 মানুষ, এবং তার থেকে 6 গুণ মানুষ আক্রান্ত হচ্ছে। আপনারা জানেন ক্যান্সার, টিবি, সার্ভিক্যাল ক্যান্সার, হার্ট ডিজিজ সবগুলোই এনসিডি, এবং সবগুলো কারণেই যে মৃত্যুর হার, প্রত্যেকটা মৃত্যুর হারই আমাদের কোভিডের মৃত্যুর থেকে কমপক্ষে 5 গুণ। কিন্তু আমরা কেন যেন শুধুমাত্র কমিউনিকেবল ডিজিজের প্রতি বেশি আমাদের এমফেসিস দিয়ে থাকি। দিস ইজ হাই টাইম ফর আস টু থিঙ্ক দ্য ইস্যুজ, বিকজ এনসিডি ইজ মোর রিস্কি. So we'll take the decision how we can protect the risk of NCD. Here are a lot of actually technocrats there. They are renowned person in the health sector, and I do believe that we'll get a lot of indications from their proposals, their articles, and I do request all of you to think the issue very sincerely so that we can overcome the problems of NCD in our country. একটি তথ্য দিয়ে শেষ করি, শুধুমাত্র ডায়াবেটিসের কারণে বাংলাদেশে এই মুহূর্তে বিভিন্ন তথ্যে বিভিন্ন রকম এসছে, তবে আমি লেটেস্ট যে তথ্যটা পেলাম 8.4 মিলিয়ন মানুষ ডায়াবেটিক আক্রান্ত। সবাইকে পরীক্ষা করলে সংখ্যাটা আরও বাড়তে পারে, এটি অ্যাজিউম করা হয়েছে। এবং তাদের শুধুমাত্র ইনসুলিনের জন্য খরচ হচ্ছে প্রতি বছর বাংলাদেশে এই মুহূর্তে 16,800 কোটি টাকা, শুধু ইনসুলিনের জন্য। জাস্ট থিঙ্ক অ্যাবাউট দ্য ইস্যু। একটি মাত্র ডিজিজকে যদি আমরা কন্ট্রোল করতে পারতাম, ডায়াবেটিস ইজ দ্য মাদার অফ অল ডিজিজেস। If we can just control the diabetes, I think it will give us a lot of opportunity to invest our money in other issues, other problems. So with this strategies, I am drawing your attention to give you the emphasis on the NCD. Dear audience, I am really happy that in this morning, this is an opportunity for me to share some of my views regarding the NCD issues. I do believe our present government is trying level-based to address all the problems of health, but it is a comprehensive issue. So a lot of stakeholders are involved with this process. So I do request all the stakeholders to contribute from their own position to address this problem. আমরা অবশ্যই ভবিষ্যতে এই সমস্যার সমাধান করতে সক্ষম হব। কোনো সমস্যা 100% সমাধান করা যাবে না, তবে গ্রহণযোগ্য পর্যায়ে আমরা সমস্যার সমাধান করতে পারবো, সেই প্রত্যাশা ব্যক্ত করে আমি বক্তব্য শেষ করছি, এবং সেই সাথে আপনাদের সবাইকে এই বক্তব্য শোনার জন্য অনেক অনেক ধন্যবাদ ও কৃতজ্ঞতা জানাচ্ছি। I am actually concluding my remarks with expressing my thanks and gratitude to all of you for your patience hearing. Thank you, everybody.
Thank you, sir, for your very informative speech. Now, I would like to request the chairman of this session, Professor Dr. Ridwanur Rahman, Professor and Head of Research, Universal Medical Research Center, to deliver his speech.
Honorable Chief Guest, respected special guests, other people on the dais and the august gathering. Thank you so much for giving us opportunity to hold this conference first time in Bangladesh. And I must thank the organizers, the eminence, NCD Control Department of Government of Bangladesh, ICDRB, BSMMU, and many other stakeholders who joined their hands to make this conference a success. As has been said, that the NCDs are a hindrance to sustainable development around the world, and more so in low and middle income countries like ours. The major reason why it is a hindrance to sustainability of development is that NCDs are causing premature deaths. People are dying before 70s are considered premature deaths. And we need to address on a population basis if we really want to reduce the mortality by 1/3 by 2030. This is said in SDG 3.4. So the activity taken by the government are enormous. Despite this enormous effort from the government alone, the control, NCD prevention and control program, we could not make much headway because this cannot be done by health ministry alone. We need a coordinated approach, a population-wide approach, whole of the population approach, as well as a whole of the government approach to achieve the SDG goal by 2030. So through this conference, we join hands, first time in Bangladesh, and we join hands together. We have today our Honorable Mayor here, because for example, in cities, we need to create walking spaces. We need to create cycling spaces. We need to create fields, which are not easily available now, but we need to plan for future. We need to give people opportunity and motivate people to use those. This is the way how we can prevent and control NCD. The treatment is very expensive and often associated with disabilities. So we need to prevent these diseases. To prevent these diseases, we all need to provide input. So Bangladesh is fortunate that for the first time, even it is for the first time that we came together. We want to stay together. We want to carry forward the commitment of the government to SDG, and we, inshallah, will be a success in near future. With this few words, thank you very much. Thank you all for coming here and giving a patient hearing. Thank you, Mr. Mayor.
Thank you so much. By this, we would like to end this session. We would like to express our thanks and gratitude to our chief guest, Mr. Sheikh Fazlinur Taposh, Honorable Mayor, Dhaka South City Corporation. With him, we would also like to express our thanks to our guest of honor, special guests, the attendants and participants who are in person in this auditorium. And also, we would like to express our thanks who are being connected with us in Zoom and online. And we also want to express our thanks who has sent the message in this session and also were connected and gave their speech on Zoom. By saying this, we would like to end this session. Stay safe. Thank you so much.